Hyperthyroidism. Quick introduction. So thyroid hormones, which are produced in the thyroid gland, are two active hormones that we want to talk about, T3 and T4. So T3 is actually involved in increasing the metabolic activity of most cells. In the heart, thyroid hormones regulate the synthesis of several cardiac myocyte contractility-related proteins. So increasing the thyroid hormone levels increase contractility and vice versa. Epidemiology. So hyperthyroidism is 5 times more common in women than men. It occurs most often, or the most common age is between 30 and 50. Most common in smokers. Hyperthyroidism can be caused by multiple diseases. Etiology. So most common cause is called the Graves' disease, an autoimmune disorder. What happens in this case is antibodies bind to the receptor on the surface of the thyroid cell. This causes an unregulated stimulation of the thyroid gland to release thyroid hormones, and it can also cause fibroblast proliferation. Pathology. So you have the thyroid gland that enlarges, so hypertrophy of the thyroid follicle cells, and those are the two big things you want to know about pathology. Moving on to clinical presentation. So what are you going to see in hyperthyroidism in the clinic or the hospital? So there's many different ways it can present. So heat intolerance is one of them. Tremors, palpitations, anxiety, resting tachycardia, weight loss despite a normal or increased appetite, and then increased frequency of bowel movements, diarrhea, shortness of breath, among others. The diagnosis, so you want to look at the TSH levels. These levels are expected to be low in primary hyperthyroidism. You want to look at the T4 levels. You also want to determine the etiology, which may be important for the treatment. You can do thyroid stimulation, immunoglobulin laboratory studies, and then you also want to look for higher normal uptake of, which may indicate a de novo synthesis, while low or absent uptake may indicate destruction of the thyroid tissue or ectopic thyroid hormone production. And then a few different things that it could be. So the differential diagnoses could be a panic disorder, atrial fibrillation, thyroiditis, and of course, hyperthyroidism can also lead to AFib as well. So you definitely want to be on the lookout for that. And that is the short introduction to hyperthyroidism.